You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthroughs in the treatment of gum disease. According to my first guest, no more bleeding gums, no more bad breath, no more puffy gums with the new advances in laser therapy. With us, we have Dr. Yetta McCullom. Dr. McCullom, welcome to the program.
Thank you for having me, Randy.
All right. Now, before we get into today's topic, tell us a little bit about your practice. I laugh a little bit when I say this, but the dream team.
Yes, the dream team.
What does that mean exactly?
The dream team consists of me, the periodontist, my husband, the oral surgeon, Cornell McCullum, and then a very skilled general dentist, Dr. Robin Ferguson, who takes credit for all of the work Cornell and I do.
All right.
Because she makes everybody beautiful.
All right.
Whereas Cornell and I do all the background work. I treat the gum disease. Cornell removes teeth, places the implants. And then Dr. Ferguson has everything perfect, and she finishes it off with the veneers, crown and bridge, beautiful fitting dentures. She takes credit for the smile.
Now, this is unique, by the way, right? I mean, to have three specialists working together under one roof.
When
is that right?
Yes, when we first started, it was quite unique, but it's a growing trend.
Is that right?
It's a beautiful way of taking care of patients. Under one roof, everything can be done. Oftentimes, the fees are even a bit less because there's not a lot of traveling back and forth, each specialist having their own fees.
Okay,
so
good
it
point.
can be very cost effective and so convenient for the patients. They love it.
And you work with your husband?
I work with my husband. For 20 years, we've been working together.
That right?
Yes,
Is that right?
yes.
Now, let's talk a little bit about your specialty. You're a periodontist.
Yes.
And so what do you spend most of your days doing?
I save teeth. I'm the superhero for saving teeth. That's what I do.
Okay, good.
And so a lot of times I'm that second opinion after someone's been told, you got to lose your teeth.
Like your teeth have to go.
Your teeth have to go. And then the patient goes, is there anything else you can do for me, doc? They'll send them to me. And sure enough, I can save teeth that a lot of other dentists would just put X's on.
So you've actually been told, people come to you and say, my teeth have to go.
Oh, yes.
And their teeth don't have to go.
True.
And so what are you doing differently? Or how are you looking at it differently?
I look at it differently because I know what the body can do. I know the miracle of the body's ability to heal and regenerate itself. That's what periodontists have a lot of insight into that general dentists may not really understand. So I know what the potentials are. I know that there's hope where a lot of other dentists may not think so.
So moving on to today's topic, gum disease. And there's new treatment options. What defines it, or what are the symptoms?
I would say a person would notice bleeding of their gums.
All right. Like bleeding when? I mean, just
when they're brushing, when they're flossing, sometimes when they're eating.
A little bit when you floss?
Bad technique, yeah.
Okay.
But usually you shouldn't have bleeding when you're flossing. That's a sign that there's inflammation or infection.
And you're headed for?
Well, you're headed for possibly more inflammation, possibly bone loss, loose teeth. I mean, it's a long chain of events, but the early signs can be bleeding. It can be sensitive teeth to hot and cold.
All right.
It can be periodic swellings. It's amazing how many patients I get who have had abscesses in their mouth. Rinse with peroxide, do a little home remedy action. It works, so they figure they're okay.
Okay.
Not the case. It's a slowly sneak type disease. It can really go very unnoticed.
So when you say, puffy gums?
Puffy gums, swollen gums. But because it slowly develops, a lot of times people think that this is just the way I am.
Yeah, okay.
This isn't a big deal. And it is.
So it's a matter of just getting in
early, keeping up with your dental care, and having a particular type of examination known as a periodontal exam, where the dentist measures around each tooth. That's really the only way to know.
Okay. Now, my original question of what is periodontal disease, I mean, we asked the symptoms, but you say it's an infection under the gum line.
It's an infection under the gum line.
And by the way, is periodontal disease the same as gum disease?
Well, we're talking
Loosely.
different terms. Yeah, they're lay terms. Like gum disease is a very broad topic. Specifically, scientifically speaking, you have gingivitis, which is just the gum tissues infected. Then you can have periodontitis, which means that you also have the loss of bone.
Okay.
A significant difference.
All right, all right.
It's an infection under the gum line that can progress to the loss of bone support around the teeth and then the eventual loss of the teeth.
Now, how big of a problem is it, by the way? It's the #1 way people lose their teeth? Is that right?
For adults, it's the #1 cause of adult tooth loss.
Okay.
The statistics are going to increase. There's a major study going underway that is going to show that the prevalence of gum disease or periodontitis is even more than what we thought. So I think that data will be coming out soon. I'm not sure when it will be published. Okay. I kind of got the inside scoop from the president of the American Academy of Periodontology, but the numbers are going to show that more people have advanced gum disease than what we once thought.
Okay, now the good news is, you say with this laser,
oh yes,
with the right candidate, you can wipe it out. No more bleeding gums, bad breath, things like that?
Yes, I can control periodontal disease. I can't say that I can cure it, because it's a chronic infection. It can be well managed, just like people are walking around with well-managed hypertension, well-managed diabetes. I can help patients manage their periodontal disease, keep their teeth, have a healthy mouth, fresh breath, no bleeding, no swelling. I can minimize all of those symptoms.
Why the breath? How does gum disease or periodontal disease affect the breath?
Well, bacteria put out odors. Foul smell can come from food that's stuck between the teeth that hasn't been flushed out.
Okay.
Bacteria create odors. We're all familiar with that. So when you smell a breath that's foul, it's from decayed, dead tissue.
Under the gum line.
Under the gum line, above the gum line, on the tongue. I mean, yes.
Do you ever have spouses that drag the other one in because of that?
As a matter of fact, since you mention it, just this week, a wife told her husband to come and see us. He had advanced periodontal disease. He looked bad. He had missing teeth. And yesterday I saw him, and his wife is so happy. I mean, he has a new front tooth. His gum disease has been treated. I don't know who's happier, the wife or the patient.
So how do you do it? So his bad breath is gone? Like after a couple of treatments?
It's a lot better. Yeah. Oh, yeah. After one treatment, one good treatment
with the laser,
with my laser.
What, you zap these bacteria, or what?
Well, you kill the bacteria. You do a very deep cleaning, and then you allow the body to heal. So in one appointment, I can have a dramatic change on a patient.
What does the patient say? Okay, so his wife was happy.
The patient's very happy too. He feels good. He feels better about himself, and so it's turned out quite well, and it turns out well for everyone.
So gum disease at the top of the show. We talked about new breakthroughs. So this laser has changed dentistry.
It's changed dentistry.
Bit,
it's certainly,
your job.
yes.
So how is periodontal disease normally done, and how do you do it?
Normally, periodontal treatment is done in phases.
Okay.
The first phase is called scaling and root planing. Lots of people have that. It's a deep cleaning where they scrape off the deposits. Right. Some patients call it, oh, yeah, I've had my teeth scraped. That was done about 3 years ago. So that's the first step. It's that second step that people say no to. It's a surgical procedure where I peel the gums back away from the roots and the bone.
All right.
And regrow the bone by adding bone. I cut away gum tissue, and that was not the most appealing of options for many of my patients. Right? It sounds bad. Your gums are going to be peeled back. You're going to have stitches.
You have to cut the gums.
You have to cut the gums. I did it for 20 years. People would accept the treatment. You end up with longer looking teeth. It's better than the active disease, no question about it, but it wasn't an easy sell. Not many people wanted that phase. Right.
But that was the only way to do it in the old days.
That was the way that I would treat gum disease.
And that's the way it's being done nationwide for the most part.
Nationwide, gum surgery,
of the time at least.
Yes.
This painful surgery. And you do it differently.
Now I use my laser.
Tell me about that.
Well, instead of peeling back the gums as a separate procedure, I combine the laser with the deep cleaning.
All right.
So in one appointment, you're getting the teeth cleaned. The laser is passing right along the teeth, just walking around this thin fiber, maybe 3 hair width in diameter, is walking around the teeth, and it kills off the bacteria. It sets the stage for normal healing to become successful. The body is always trying to heal itself.
So the gums get
The gums get tight around the teeth. I can even regenerate bone around the teeth.
Okay, okay.
I don't have to put in sutures. The post-op is a breeze compared to the other surgery. Minimal actually, when the patient leaves, there's this beautiful blood clot. Well, to me, it's beautiful. But there's this nice hemostatic clot that's present, and it stays in place, and it promotes this wonderful healing that can occur. So that's the way I do my surgery now.
Now, something interesting you told me on the phone. You said, Randy, I was at a meeting, a
Yes.
periodontal meeting, and they're showing
A live
the surgical
surgery.
procedures.
Yes.
And you said when you saw that, it was like ancient history.
Right, right.
Elaborate on that. What do you mean by that?
Well, I was looking at this wonderful surgeon, beautiful technique, and he
To get rid of gum disease.
To
we
get
should
rid of
mention.
gum disease
Okay.
and to regenerate bone. So he made this beautiful scalloped incision. He removed this layer of gum tissue.
Infected gum tissue.
Infected
Okay,
gum
okay.
tissue and some healthy gum tissue. But he removed, this was standard of care. You would remove a layer of the gum tissue, and then you clean out all the infected gum tissue, and then you add bone in certain areas, and then you suture everything back together. And I'm sitting there, I'm admiring the surgery, while at the same time saying, I don't do that anymore. I don't have to do that. I can get the same
You said
result.
like ancient history.
Yeah, for me, I mean, 4
I
years.
mean, you can get the same result
Yes.
with a laser.
With the laser,
Without the cutting.
without the cutting, without the suturing, without the bone grafting material, without the growth factors. I mean, there's a lot of stuff that periodontists have to help the body regenerate, but it's in a bottle.
Okay.
I use what the body has provided to heal, and it works out beautifully.
If it's as good as you say it is, why then why is it that not 100% of the dentists are doing it this way?
Interesting.
What's your take on that?
Well, I just finished an article that talks about adoption of new technologies. It's very difficult for people to let go of what they're accustomed to doing. So there's obstacles there. There's a financial obstacle. The laser is not a cheap.
It's like $100,000.
It's not a cheap piece of equipment. It
Okay.
really isn't. And then people like the way they do things. You know, they kind of identify with their method. And so it's hard for some people to change. In my world, I guess I'm an early adopter.
Okay.
So I'm willing to try.
So you've been doing this for
4 years.
For 4 years using the laser. You know, another thing, but I'm trying not to, and we're talking about gum disease. No more bleeding gums, no more bad breath, puffy gums, things like that. Have the smile you've always wanted. But one of the things I said, what is your goal when we talked on the telephone? You said, I want to cure the south side of Chicago of gum disease.
Right, right. That's my superhero goal. I want to cure my patient population of gum disease. I know I can't cure it, but I can certainly help them manage it and be healthy. So many of my patients have so many medical issues, hypertension, diabetes, all of these problems that lead to early death, I just have to say. And infection is not healthy. So I am part of the team of health providers that are really improving patients' quality of life. I believe I'm improving their longevity by helping them with their health.
And you want to wipe it out.
I'm wiping it out.
Do you believe that if people go to you early enough and they use the laser and home care, et cetera,
Yes.
that you could wipe it out? That they would not lose their teeth?
Oh, no question. I have patients. I'm fortunate that I have a practice that I purchased from another periodontist. So I have patients in their 80s and 90s that still have their teeth. And they've had advanced bone loss forever. So I know that that periodontal therapy works.
Okay.
All forms of periodontal therapy work. It's just to what level and how invasive do you have to be to get the result.
Now, when you talk about bone loss, okay,
Yes.
so this infection under the gum line.
Yes.
It eats at the tooth,
It eats at the bone.
eats at the bone,
It eats at the bone.
just the bone.
Just the bone.
So the longer you have this gum disease,
Yes.
like the bleeding gums, one of the symptoms, it makes it tougher to what? Save the tooth?
Yes.
Is that why the teeth are loose?
Yes.
Okay, so the laser goes in, zaps it. I want to make sure I have this correct.
Right.
Kills that bacteria.
Yes.
And the gum grabs onto the tooth a little bit better?
Okay,
Do I have it somewhat right?
here's the deal. When you have an infection, your body tries to heal it. It brings in more blood vessels.
So if you have a cut,
If you have a cut, you notice it has a period of healing where it's a little puffy, it's a little swollen, and then it heals over.
Okay.
If it were an infected cut, it would stay puffy, it would stay swollen, and it would not heal.
okay,
All right? That's what's happening in the mouth.
interesting.
So what I do.
And nobody would dispute what you're saying, by the way?
Oh no, this
okay,
is
so this is a known. Okay.
This is just standard wound healing.
Okay.
If there's a wound, if there's an infection, the body goes through steps to heal itself.
All right.
So what happens is with periodontal disease, the bacteria stay there. So you have this chronic inflammation that just stays there. So what the laser does is it gets rid of the bacteria. It lowers the level of the bacteria so that the body's elements, the healing mechanisms, can be successful. And that's where the regeneration occurs, and the reattachment, and the connective tissue attachment. And this has been shown, this laser procedure is the only FDA-cleared laser for a patented protocol.
Okay.
This laser has been out for 10 years. It's the only company that actually has the histologic study that shows regeneration and reattachment.
So it works. I mean, it definitely works.
It works. It works for the patient, and the dentist cannot dispute the science.
But it's also made your job a lot easier, you said. You know, in the old
yes.
days, you would do the cutting procedure for gum disease, which is done, by the way, in Chicago every day. Is that
Every
true?
day, all across the country.
Like hundreds and hundreds, though, in Chicago
Yes.
alone? I mean,
periodontal disease is worldwide,
okay,
but
so
yes, in
no
Chicago.
more cutting. I mean, you shouldn't have to do it with this new laser.
Correct.
Okay. So, but you say in the old days you would do one side of the mouth.
Right.
And you couldn't even get them back in for the other. Elaborate on that.
Well, of course, I wish I could say all my patients came back for the other half, but often after that first experience, patients prefer not to finish. As a matter of fact, the first year I had my laser was the worst of the recession. I had my best year in business because all of my patients in my practice that had refused surgical care accepted the laser treatment.
Is it about the same cost, by the way?
It's less.
It's less than the traditional
gum
surgery.
Yeah, in my practice, for me personally, I don't charge as much as I did because I'm not working as hard. I'm not using as much material. I don't use bone.
The downtime, I mean, it doesn't hurt.
And it doesn't hurt as much. It's really an easier procedure for everybody.
Now, so who should get this done, by the way? Okay, so people watching this, they have bleeding gums, puffy gums, they have the obvious symptoms,
Yes.
loose teeth.
Oh yeah, they're a candidate for the laser procedure. They're a candidate for periodontal therapy. They need to talk to their dentist. They can easily contact me, but it's quite likely that they would benefit greatly from the laser procedure.
Do they need a referral to see a specialist?
No, you
Okay.
don't. You don't need a referral. You can just call me directly.
All right, and they get to meet with you?
Yes.
And they get to meet the rest of the dream team?
They get to
Or
meet
just
the
watch
dream
them
team.
pass by the...
They get to meet everybody.
All right, okay, good. Now, you brought a photo.
Yes,
and
I
this
did.
This is very interesting. By the way, if you're just tuning in, we're talking to a periodontist, Dr. McCullom, and we're talking about new treatment options, new breakthroughs in the treatment of gum disease, and having the smile you've always wanted. And this is also about smiling and
Yes.
self-confidence. But this patient came to you and was told by another dentist, all of those teeth have to be extracted.
Yes, and this is a young lady that is in her late 20s, early 30s.
Okay.
She has a specific type of periodontal disease known as rapidly progressive,
Okay.
which is genetically passed on to each generation.
All right.
So she was told she had to lose all of her teeth. She wanted a second opinion, which I would advise anyone who's been told they have to lose their teeth, get a second opinion.
Go to the dream team.
Go to the dream team.
Okay.
And so what we did is we assembled a treatment plan for her, which began with my laser treatment.
Okay, but when you saw her and you met with her,
Yes.
in your mind, did you go, oh boy, this is going to be
This is
good?
going to be a tough case, but
Okay.
I think I can help her. I think there's hope. I don't think that right now she has to lose all of her teeth.
What were her symptoms, by the way?
Bleeding gums, loose teeth, shifting teeth, bad breath.
Pretty miserable?
Yes.
How old is that person?
This person was probably 32.
Interesting.
Yes.
It's too young to obviously
Oh yeah,
have
just to
dentures.
even psychologically get your head around losing your teeth in your 30s. That's just not working.
All right, all right.
Yeah.
So what are her options and how do you tell her?
Well, her options are to treat the infection, move the teeth back where they belong, and then see what teeth we can keep and what teeth need to go.
All right.
And that's how we like to approach things. We can't save every tooth all the time, but certainly when teeth have shifted, what we like to do is turn back the hands of time, put those teeth back where they belong.
So the main thing is get the gums healthy.
Got to get the gums healthy
first. So you go
first.
in there with your laser.
I'm the first man I'm the first man up. Right. I get the gums healthy. I get the bone support healthy as I can get it.
Okay.
And then they go into the next phase. For her next phase was braces.
Okay.
Okay? If she had any active tooth decay, that has to be dealt with. That's what Dr. Ferguson would do. So we did all of that. We sent her to the orthodontist for the braces, and then she's still in treatment, but this is how she's looking now.
Very nice.
She's lost one
Those
front
are the
tooth.
same teeth?
Well, she lost that front tooth that was looking kind of long. We had to have that one taken out.
Very nice.
But she's on the road to recovery. She understands.
But that's a beautiful smile.
She can smile. She was like this. Oh, hello, Dr. Yetta. You know,
Is there a lot of people like
that? Yeah. Oh, you see it every day. People that talk to you and then they smile like that, hand up.
Or laugh with their...
Yeah, or laugh. So we see that all the time, and our goal is to get that hand down, get them used to smiling, get them comfortable again.
But okay, so in her case, bad breath goes away.
Yes.
And the teeth.
She's going to have loose teeth. I have many patients with loose teeth because we can't grow back 100% of the bone, but certainly a loose tooth is better than no tooth.
But eating and chewing is not an issue.
Eating and chewing, she can eat better. She may not bite into a hard carrot. I mean, there's certain realities that certain people have to deal with, but she has her own teeth.
Case.
This is an advanced situation.
Are you proud of that case, by the way?
I am.
Because she was told all these teeth have to be...
I'm very proud. And she keeps up with her maintenance. She feels good about herself. She's happy.
Is that common, by the way?
It's more common than you might think.
But is it common that people that were told there's no hope, or they thought themselves there's no hope?
Oh, yes. I give them hope. That's what they say to me. They say, Doc, you gave me hope. Yes. Super doctor. See,
do you ever, when you're out and about, can you spot gum disease?
I do.
And do you think, boy, I need to get them in here?
I kind of give my card out. The
Really?
older I get, the more comfortable I am with just saying, you know, you need me. Especially with this laser.
Like at what, in the grocery store?
In the grocery store. Especially now that I've got this laser and I know I can really get this done and it's not going to be as bad as you think, I'll give out my card.
Now, your husband who works with you, she works together, they call him the Dream Team, general dentist. Your husband's an oral surgeon. Does he ever elbow you and say, please?
No,
Don't give the card.
I tell my husband and Dr. Ferguson, don't even call me if you plan on taking out teeth, because I will save the teeth.
Wow.
Don't bring me in the room if you guys want to take out somebody's teeth.
Is that right?
Yes, because I save teeth.
I don't even want to hear about it.
I don't even want to hear about it.
Great, great information. Final message, though, people, or a recap, I should say.
Okay.
People that have gum disease, maybe it's been diagnosed, maybe it hasn't been diagnosed. What's your main message?
My main message is to make sure that you are seeing your dentist and finding out if you have gum disease. If you know that you're flossing or brushing and there's bleeding, then you have a problem.
Is that right?
Yes, and don't let anyone tell you that there's not a problem.
So if you're flossing,
a little bit of blood, you need to get it checked. You need to make sure your dentist is doing your periodontal exam.
Where are they headed with that bloody flossing?
The potential is that you're going to head down the hill of losing bone and losing your teeth. The only way of knowing is if you're under the care of your dentist or your periodontist. All right. Not everybody progresses to the loss of their teeth, but the only way you know is if you're constantly following up. Just like women get mammograms, just like people get an annual physical and get their blood pressure checked. You need to make sure you're checking for oral health. So that's the message. Don't assume that just because you've got those teeth today, you're going to have them 10 years from now.
Okay, now without the bleeding, though, they could also just have puffy.
No.
Swollen gums.
And even bleeding isn't a sign. If you're a smoker, if you have diabetes, you need to get things checked out because smoking will mask that sign of bleeding. You don't even know that bleeding is always indicating that there's a problem because a lack of bleeding, you could still have a problem. Some of my patients don't have bleeding gums, but they still have advanced bone loss. So the only really way to know is if you're having consistent periodontal exams. I'm not just saying one exam and then you're okay. I'm saying every 1 to 3 years, you need to have a periodontal exam and a heart-to-heart discussion either with your hygienist, your general dentist. I think everyone should have a periodontist, personally.
Okay.
I see no reason for you not getting a
It doesn't
periodontal
cost more to
exam.
go to a
No,
periodontist.
it doesn't cost more to
Okay.
go to a periodontist. You don't have to have a referral. I can treat an entire mouth of teeth for the cost of replacing one with an implant. So it's cost effective.
So I get this right. I mean, we talked to the telephone. You presented a great case for this, and I looked in San Diego, and I really couldn't find anybody here with this laser. Okay.
Oh, okay.
But I couldn't help but think, I want somebody to go around my mouth with this laser and kill any bacteria that I have.
Right.
I mean, logically, is that fair to say?
Yes,
I don't really
yes.
have symptoms, but why not?
Why not? And there are different types of lasers. We didn't even get a chance to talk about that, but there are
Okay.
different types of lasers, and that's a whole nother show.
You have the best laser?
I've got the best one.
Okay.
But there are hygienists that can use a different type of laser on different settings. There's benefits to that laser type treatment. The one that I use is for surgical care.
Now, but this, how important is the smile, by the way? Because you said on the telephone, you said, Randy, I want to make sure that this is about having the smile you've always wanted.
Yes.
So, of course, you're a dentist, you think that the smile is important. How
Well,
important is it?
Everybody knows it. You may not consciously know it, but subconsciously, you are looking at a person's face, you're seeing that smile, and you're reacting to that smile. I have a story to tell. My father had advanced Alzheimer's, and I showed him a picture of Barack Obama, and I said, Daddy, this guy's running for president. He said, with a smile like that, he can win. Now that's what, and my father had advanced dementia, but he still recognized a smile and the importance of a smile. So women that I talk to, they say, I couldn't deal with that guy. He needed some dental care.
Is that right?
Oh, yes.
Well,
Your
there's no
smile's
doubt about it. I
important.
mean, a smile
We
is,
all
is
know that.
attractive.
Oh,
And
yes.
even on a job interview, if a person's smiling,
Right.
the other person is not smiling, who do you hire? With the same
smiling.
background.
Exactly.
The happy person.
Right.
Very good. I want to thank you for coming on the
Oh,
show.
my pleasure, Randy. Thank you for
really,
having
really
me.
good stuff. And we're going to have your
Thank you.
husband on the show as
Yes.
well. I can't wait to meet him. And so final messages, call, make an appointment, visit your
Right.
website.
Definitely. Visit our website. You can get a lot of information there. You can call. We do a complimentary consultation. We'd love to have you come to the South Side and visit us. Visit your dental dream
The
team.
Dream Team. All right.
Yes.
Thanks again. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website at wellnesshour.com and just put in Chicago Dream Team or gum disease or no more gum disease. And especially, you just put in Yetta McCullom or Dr. McCullom. For now, I wish you could help.